who work for the Prime Minister that they are seized with this issue. They are concerned about the possible impact.
All right, thanks, Vashi. Here is the Prime Minister of Canada.
Before we get into things, I have two pieces of news to share with everyone. The first one is about the distribution of critical equipment to provinces and territories. For the past few weeks, our government has been working closely with industry to produce the supplies our healthcare workers need, like masks, face shields, gowns, ventilators, and test kits. Well, today I can announce that our government has signed an agreement with Amazon Canada to manage the distribution of this equipment to the provinces and territories. Aujourd'hui, j'annonce que notre gouvernement a conclu une entente avec Amazon Canada pour acheminer du matériel médical aux provinces et aux territoires. Amazon utilisera son grand réseau de distribution pour assurer la livraison d'équipements médicaux là où on en a le plus besoin. La deuxième nouvelle dont je veux vous faire part ce matin est en lien avec l'armée. On a reçu une demande du gouvernement du Québec pour une intervention des forces armées pour prêter main forte aux communautés nordiques et isolées. Comme je l'ai dit plus tôt cette semaine, nos membres sont toujours prêts à
Our members are always ready. COVID-19, so I can confirm that the Canadian Armed Forces will be there for
Depuis quelques semaines, la COVID-19 chamboule les vies. On fait l'école à la maison, on réduit nos déplacements, on reste chez nous le plus possible. On vit tous les conséquences de la pandémie, mais certaines familles traversent des moments encore plus difficiles et plus incertains. Si vous avez perdu votre job, si vous ne recevez plus votre chèque de paie, vous vous demandez non seulement comment vous allez payer vos factures à la fin du mois, mais l'épicerie le lendemain. Across the country, there are food banks that can help. But like most organizations, food banks are facing new challenges because of this pandemic. With everyone staying home, they have fewer volunteers. And a difficult economic climate means that they're receiving fewer donations that they normally would, while demand rises. The staff at the Neighbor to Neighbor Food Bank in Hamilton told us they're getting more and more calls. And it's overwhelming for the volunteers who are spread really thin and working overtime to help their community. The work being done by food banks and their volunteers is essential, so there's no question that they need more support during this crisis. If you have the time and ability to help, reach out to your local food bank and ask them how you can help them. At the same time, I'm announcing that the government will provide $100 million to meet the urgent food needs of vulnerable Canadians, including those living in Indigenous and Northern communities. This money will help ensure that organizations can buy and deliver food to those who need it the most. It will help support organizations that you may already know, like Food Banks Canada, Breakfast Club, and the Salvation Army, and many more. And on that note, I do want to take a moment to thank all volunteers and organizers. Thank you for feeding our communities. We see you, and we are grateful for the incredible, tireless work you do, even in these extremely difficult circumstances, especially in these extremely difficult circumstances. You are doing essential work for our most vulnerable. You are showing what it is to be Canadian, to be there for each other in times of difficulty.
Today, I am announcing that the government will invest $100 million to meet the urgent food needs of the most vulnerable, including people living in northern and Indigenous communities. This money will help food banks to buy and deliver provisions to those who need them. Since the beginning of the pandemic, food banks have been facing specific challenges. For example, most of their volunteers are people who are retirees and who are more at risk of being infected. That means fewer people to serve a larger clientele. Food banks and charities are doing an incredible job in our communities. and they do so all year long. I'm thinking of the town of Villeray that I'm familiar with, where people are working very, very hard to help their neighbors in my riding of Papineau. If you have the time and the ability to help these days, I invite you to get in touch directly with these organizations in your neighborhood. They need your help. And with today's announcement, we are supporting a number of organizations that you may already know, such as Moisson Montréal, the Baked Breakfast Club, and the Salvation Army. And in fact, I want to take this opportunity to thank all the volunteers and organizations for their excellent work. You are feeding our communities, and we very much appreciate everything you are doing. It's not easy. There is a great deal of demand. You're limited in terms of your resources, but I know that you will continue to help your neighbors and to help people who need help. That's what we do at difficult times. We're there for each other, and we will be there for you. I know there are many of you who are going through difficult times. The pandemic is creating a lot of uncertainty, and you're worried. But I want you to know that our government will not abandon you. We are investing in food banks so that you can meet the urgent needs of your family during this crisis. And at the same time, we are offering financial assistance to people who've lost their jobs or their paychecks because of COVID-19. We are introducing the Canada Emergency Response Benefit that will give you $2,000 a month. Our government will also increase the GST credit to help people whose income is low or modest. We said that adults who are eligible would receive up to $300 or $150 per child starting in May, but I can now confirm that they will receive that help this month in April.
Our government is also supplementing the GST credit to help low-income people. We had said that in May, every qualifying adult would receive up to $300 with $150 for each child, but I can now confirm that help is coming sooner, this month, in April instead. Our government has also been working with major banks to deliver benefits, including the CERB, through direct deposit. Effective today, people should visit their bank's website for information on how to enroll for direct deposit if they haven't already. Je sais que vous êtes nombreux.
I know that many of you would like to know how much time this will last. You're wondering when you're going to be able to see your friends, hug your grandparents, or have people over for dinner. Last night, I had a discussion with the premiers of the provinces and territories, and we talked about data sharing and projections. The good news is that many more people are being tested, and experts have new data to analyze. The provinces and territories are now updating their information and will be publishing the latest data very soon. On our side, we're working very hard to verify the latest figures so that we can put them online. You can consult canada.ca/coronavirus to get the best information, updated information about the spread of the virus. I'd like to be able to tell you exactly when all of this will be over. I often talk about weeks and even months, but the reality is that it will depend on each of us. The best way to minimize the impact of COVID-19 is to continue to follow public health directives. You know them. Stay home as much as possible. Limit your movements. And if you absolutely must leave home, keep a distance of 2 meters from other people. Continue to do your part, and I promise you we'll come through this. I'd like to close today with a message for young people and children. On Sunday, I will be holding a video conference on you with Dr. Tam. You can send me your questions today at the Radio-Canada website, and I will be looking forward to answering your questions on Sunday.
On Sunday, I'll be holding a video conference focused on you with Dr. Tam. So send me your questions through CBC Kids' websites by the end of the day, and I'm looking forward to answering you this weekend. Merci beaucoup tout le monde.
Thank you all very
Thank
much.
you, Prime Minister. We'll now go to the phone lines for a few questions. One question and one follow-up. Operator?
Thank you. Merci. First question, Kate Bolingaro, Bloomberg. Your line is open.
Hello, Prime Minister. I have a question regarding the OPEC. Canada planning to meet with, has been invited to meet with the party in talks.
I'm sorry, Kate, your line is cutting out a little bit. Can you try and speak closer to the phone and a little more clearly?
Yes, no problem. Can you hear me now, Mr. Prime Minister?
That's much better. Thank you.
Okay, so my question is regarding the OPEC Plus meeting on Monday. Is Canada planning to meet with, has it decided to meet with, or is it already talked OPEC other oil producing nations about coordinating output levels to help bring crude prices down? And what would you want this potentially look like?
I can assure you that we've been coordinating closely with the United States and other allies in looking at the challenges faced by OPEC right now. We recognize that these catastrophically low oil prices are having an impact on many people's economies and indeed on Canadian oil sectors. We're trying to coordinate to ensure that we make sure that our economy doesn't face the kinds of challenges that it's been facing. We need to continue to support workers across the country. We will continue to work internationally to try and impact on the difficult decisions made by OPEC over the past weeks, and we will keep you posted on that.
And what is happening with the support package for the oil sector we've been hearing about?
We're continuing to work with provinces, with particularly the province of Alberta, to ensure that we're giving support to workers who are in particularly distressed industries. The wage subsidy and the Canada Emergency Response Benefit will be of help to people right across the country, including in the oil sector, but we recognize that certain industries are facing much greater stresses than others, and we will continue to work with the provinces. I can highlight that in our conversation last night, the premiers and I did discuss this. I heard directly from Premier Kenney and others on the importance of support to the oil sector, and we're going to continue to work with them.
Thank you. Operator, next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Good morning, Mr. Trudeau. We are hearing that the U.S. administration has asked 3M to stop exporting N95 masks to Canada. Can you give us more details about what you know? Were you aware of that decision? And how will Canada respond to it? Well, we are working very closely with the United States at this time so that they understand what we already know very well, which is that trade between Canada and the U.S. goes in both directions, particularly when it comes to essential goods and medical personnel. There are thousands of nurses in Windsor who work in Detroit every single day, and Americans depend on them. There are medical products and other essential goods that move across the border in both directions, and it would be a mistake for both of our countries to limit access, either one's access to goods and essential personnel. That is exactly what we are pointing out to the U.S. administration, and we will continue to work to ensure that what we need will arrive.
We've been working very closely with the Americans to highlight what Canadians know very, very well, that the level of integration between our economies goes both ways across the border, that we are receiving essential supplies from the United States, but the United States also receives essential supplies and products and indeed healthcare professionals from Canada every single day. I think of the thousands of nurses, for example, who cross the bridge in Windsor to work in the Detroit medical system every single day. These are things that Americans rely on, and it would be a mistake to create blockages or reduce the amount of back and forth trade of essential goods and services, including medical goods, across our border. That is the point we're making very clearly to the American administration right now.
And a follow-up, Melanie?
Hier, M. Trudeau, vous
Yesterday,
deviez faire
Mr.
le suivi avec
Trudeau,
Washington
you were supposed to
concernant
follow
le
up with
détournement de
Washington
matériel
with
médical
respect
des
to
masques qui
the
sont
fact
achetés sur le
that
tarmac.
masks are being diverted.
Qu'avez-vous appris? Puis juste pour revenir aussi à la question
And
à
I
laquelle
just
vous n'avez pas
want
répondu, est-ce
to
que le
come
Canada
back to
va riposter en refusant lui aussi d'envoyer
whether
des masques aux
Canada
États-Unis si on
will
en envoie
respond
effectivement?
and not send
Nous
masks
allons
to the United
toujours
States.
chercher à
I can tell
continuer,
you that
le
we
commerce,
will continue
ouvert et
to
essentiel
keep
avec les
trade
États-Unis.
open with the
On
United
dépend,
States.
tous les deux,
Both of our
du commerce et
countries
des
depend
échanges de
on
biens et
that
de
trade
services essentiels de
of
chaque côté de la
in
frontière.
essential
Et
goods
nous
and
allons travailler
services on
pour
both sides of the
s'assurer,
border,
que
and we
ça
will
continue
ensure that that continues
à être possible,
to flow
et être encouragé dans ces moments de difficulté. Nous allons
and
toujours
encourage
faire
it
des
in these
suivis
times
sur
of difficulty.
les
Of
préoccupations
course,
par
we will
rapport aux
be following
livraisons.
up
Mais pour
on
l'instant,
concerns
on est
about
confiant
shipments
que,
that have been
on continue à
diverted, but
recevoir
at the
ce dont
same
on a
time,
besoin.
we continue to receive what we need.
Thank you. Next question, operator.
Thank you. Merci. Next question. Tonda McCharles, Toronto Star. Line open.
Tonda, you might be on mute.
Yeah, I am. Sorry. Thanks for taking the question. Can you clarify? Last night, this order came from Trump to 3M company to cease their exports to Canada, and you've talked about how valuable it is. But have you, since then, put in a call to the president? Do you have one planned today? And you said it would be a mistake, but it's a done deal, is it not?
3M has indicated that it understands how important it is to continue with delivering on orders to places like Canada, because there is much trade that goes back and forth in essential services, and it could end up hurting Americans as much as it hurts anybody else. That is the point that we are making very directly and have been making for many days now to various levels of the American administration, and that message is getting through. 3M a indiqué que ce serait
3M has said that it would be a mistake to limit trade in essential materials because all countries need to receive those supplies from beyond their borders, and it would not be advantageous for the United States or Americans if supplies from Canada and elsewhere could not come in. So this is something we are pointing out forcefully with the U.S. administration right now, including this morning.
Sir, you didn't indicate whether you have or will speak to the president today, but I'd like to understand from your perspective just how big a gap this leaves Canada's supplies of these crucial medical masks.
We continue to be confident that we're going to receive the necessary equipment. We understand that there are pressures across our healthcare systems in various regions on the dwindling supplies. That's why we are working so hard to ensure that we get the right supplies to them in the right amount of time. We've seen a number of Canadian companies stepping up their productions, which will be flowing soon. We're also receiving more shipments from places around the world. We will do everything we can to ensure that no part of Canada goes without essential supplies in facing this pandemic.
Thank you. Operator, one more question on the phone, please.
Thank you. Merci. Justin Ling, freelance. Your line is open.
Hi there, Prime Minister. You've been imploring people to stay home if they can. You've been asking people not to go to work. But given that, why are you still sending in civil servants to run immigration detention facilities when that could seriously increase the risk of spreading the virus not only to those detained in the facilities, but to those workers who have to go back home to their families every day? Do you consider that an essential service to be locking up people who were applying for asylum here?
We recognize that there are many essential services that need to continue to be delivered for Canadian safety, for the well-being of our country, and ensuring that Canadians are safe needs to be a top priority. That's why we're going to continue to ensure that essential services get done wherever possible. Civil servants are encouraged to work remotely, to work from home. We know there are significant things that need to be worked on to deliver for Canadians, to keep Canadians safe at this particular time. And I want to take the opportunity again to thank the public service for all it does in these difficult times to make sure Canadians are kept safe and secure.
Well, it's not really a question of safety when you're locking up those who may have overstayed a visa or who applied for asylum. And certainly, it's been 2 weeks now since I first asked you about releasing nonviolent offenders, and nothing has happened. Your government has continuously said, you're looking at it, everything's on the table, you're looking at it, but nothing's actually happened yet. Why are you dragging your feet, and why has action not been taken yet?
I can actually inform you that action has been taken. We've been working closely with Corrections Canada and detention facilities of all types to reduce the vulnerability to the spread of COVID-19, to ensure that measures are in place to keep Canadians safe. We continue to look at other measures that can be taken, and we will take those measures in due course.
Brian Mullen, Global News. Prime Minister, on the issue of 3M, you're saying if the U.S. goes ahead with this, it could hurt Americans also because of the flow of supplies and resources across the border. Are you considering any retaliatory measures against the U.S.?
We are discussing very closely with the United States the importance of keeping the flow of essential goods and services across our border to help both of our countries. I am confident that the close and deep relationship between Canada and U.S. Will hold strong, and that we will not have to see interruptions in supply chain in either directions. Okay.
We will continue to point out to the Americans that it is in the interest of our two countries to continue to share essential goods and services. This is very important for all of us, and that's why I am confident that we will be able to continue to rely on each other in the midst of this significant crisis.
Prime Minister, within the hour, Ontario officials are going to reveal their projections on the number of cases and the number of fatalities we might expect in the province. Dr. Tam has said the federal equivalent of those models are being used to inform your policy decisions, require Canadians to dramatically alter their way of life. Don't you have an obligation to follow Premier Ford's lead and release projections on the worst case and best case scenarios about how many of us might die?
We have been releasing information every single day on data received from the provinces, updating it regularly on websites so Canadians can see the latest numbers and look at various models that use those numbers to make various projections. At the same time, we need to make sure that the projections that we will be releasing are based on the most accurate, the deepest, the most properly collated information out there. We are working with the provinces to be able to build a robust model to give the projections that people want to see. People are wondering, how much longer is this going to last? How many Canadians are going to be severely affected? These are things that we will be sharing with Canadians, but we need to make sure we have a better grasp on the accuracy of the data before we put projections out there. Okay. Nous reconnaissons que les Canadiens veulent savoir combien de temps ça va prendre, qu'on va devoir continuer cet isolement, combien de Canadiens vont être affectés, combien il y aura de décès. Nous allons partager cette
and we will be
information.
sharing that information. But before we can do that, we have to base ourselves on very specific data, precise data, and better than the data we have now. And that's why we're working with the provinces to look more closely at that data and analyze it so that we can deliver a model that is much more focused on reality.
I just want to return to the OPEC questions you were asked at the top. Can you clarify, is Canada at the table at Monday's meeting, or are you just dealing with the U.S. and the U.S. is the one dealing with OPEC?
Okay. We are continuing our conversations with the international community, including with OPEC. There have been communications between OPEC and Canada. We will continue to stress that we need to work together as a world to get through this economic crisis as well as a health crisis. We will continue to insist on that.
Okay, can you please clarify if that means Canada will actually be at the table? And also, I'd like to get your thoughts on whether Canadian producers should actually be cutting their production further. They've already had to do this. More is expected because of supply challenges. So Is it a wise strategy for Canada to coordinate with a price-setting cartel that has caused many of the current problems we're seeing in the global pricing of oil?
Well, I can assure you that conversations are ongoing with the United States on how we can work together to ensure that we are countering some of the measures being brought in by OPEC, and we will continue those conversations.
Bonjour, M. Trudeau. Mathieu Goyer de Radio-Canada.
Radio-Canada.
On comprend que ce sont les Rangers qui vont aller dans le nord du Québec. Pouvez-vous donner plus de détails sur
Will
leur nom
they
et leur
be the
mission
Rangers
particulière?
in northern Quebec? Can you provide more details on that? We know that the Canadian Rangers are always present in the north to help communities there and to serve. What I understand is that the Rangers will be in Inuvik to help them install tents and other medical infrastructure, and we'll have more information on numbers in the coming hours. Now, pharmacists are thinking that they may have a shortage of certain critical medicines, such as morphine. How can you ensure that supplies will be there for the hospitals? We have a very good pharmaceutical system here, and the companies have been told to produce more material and medicines that we will need during this crisis. So we want to ensure that there won't be a shortage in hospitals, and we will continue to monitor the level of resources available so that no hospital and no Canadian is lacking the necessary medications.
Minister Olivia Stefanovich, CBC News. I imagine you have seen the projections from Ontario and Quebec that will be released shortly. Can you tell us what your reaction is to those numbers and how this will change the federal approach?
I'm not going to preempt the announcement that Premier Ford is going to be making shortly. We have seen the numbers. We continue to work very, very closely with the provinces. We are very much looking to share national projections with Canadians in the coming days. But I can tell you that we know that this is a very difficult situation for Canadians. There are some very challenging projections out there that will emphasize how important it is for all of us to do our part, to stay home, to keep ourselves safe, to keep our loved ones safe, and to get through this as best we possibly can.
How do these numbers change the federal approach?
Our federal approach continues to be to do everything we can based on the best scientific advice to keep Canadians safe and to ensure that our economy bounces back strongly after this is all through. The measures that we're encouraging and asking Canadians to take, whether it's around self-isolation, whether it's around social distancing, which means keeping 2 meters apart, whether it's around ensuring that people are washing their hands regularly and for 20 seconds. These are the things that are going to help keep Canadians safe. As much as we can do at the federal level, as much as we can support, as much as we can bring in quarantines and decrees, ultimately, it is Canadians' own behavior that will make the difference in this. How we get through this depends on you, and that's why I'm so confident that we will get through this, because Canadians are always there for each other. We're looking to do the right thing. We will get through this together. Merci tout le monde.
All right, that is the Prime Minister.